hate that. And then it hurts when they put a new set on. Like I had these nails.
We don't mind. She can slide in a little bit. All right.
Okay. Well, you ain't get the theme music going for us, so here's your ring.
No, I'll be able to. It's clean. I'll be able to add it in again.
Okay.
So, how you guys doing? Welcome to Touching Topics. Is the topic of today is mental health, and I have today with me LaWanda and Yolanda. I'm sorry, fresh guests, and they can introduce y'all to what they do.
Okay, well, I'm LaWanda Chapis. I am a board-certified licensed professional counselor and a substance abuse counselor.
I'm Yolanda. I'm a licensed social worker.
And I am Dewan Holly, and I am LPC.
So today, I have a few questions, pretty much surrounding the topic of mental health and how, or what are some of the things that we can do to help the process of mental health, or help families deal with mental health. That's the question, because I'm clueless. I know I had a little cousin that was dealing with, it might have been schizophrenia or something. I'm not quite sure what it was, but when she all of a sudden changed in her behavior, I didn't know how to deal with it. And she was like sweetheart to me, you know what I'm saying? So every time I seen her and was around her, it just like ate me up. So I didn't know how to communicate with her. Only way I communicated with her is when she went on her medication. You know what I'm saying? Like, when she was off her medication, she seemed normal. And she used to tell me like, cuz I don't like taking that medication, it slowed me down and this, that, and the other. And I used to be like, well, stop taking it, cuz, like forget them. And her sisters and brothers come to me like, no, cuz she need her medication. And I'm looking like, man, y'all tripping. She told me she don't need it, and I see the difference. You know what I'm saying? So I do know that sometimes they really do need the medication, but for other people to like understand it, is there any kind of insight that y'all can tell the people?
Well, one thing about it that's really good now is they have a DNA testing now for medication. Before we were kind of like fly giving psychiatrists. We're therapists, we're counselors, we're not psychiatrists. We don't prescribe meds. But what was happening before is people were getting diagnosed meds according to their behaviors, according to what diagnosis they were given. So they were given meds off their behaviors. But now there is DNA testing where people are given meds according to their DNA line and according to actual what symptoms that are affecting them. So they're not given medication that kind of makes them so off kilter that you don't know who they are anymore. And so medicine now is actually starting to be more helpful, where people are still more of who they are, and they're just not strangers to who we don't know who they are more. Right. And so hopefully this will make more us as African Americans start to take our meds a lot more, because I can understand not wanting to take meds when the meds are not going to make you know who you are. You're going to act totally different. You know, your family is not going to recognize who you are. That would make me not want to take meds either. But hopefully now that technology has gotten us to a new level where we can do the DNA testing and the meds are actually fit to who you are and according to your genetic line, and they can actually address your needs mentally and physically. You know, hopefully we will be more receptive as a community actually to get therapy and actually to start taking our meds. And then even in order for us to know what's going on with us, we have to be more accepting, and we have to understand what the symptoms are. We don't know what the symptoms are. We kind of are not aware of what mental health is, bad mental health is. In our culture, it's displayed as just crazy behavior.
Yeah.
So, you know, when people just tell us that we crazy, we don't understand that something is wrong with us mentally. We overlook it as it's just, you know, dude having an off day.
Right.
You know, he'll be better tomorrow, or he popped a pill, or he got a hold of a bad pill, or he smoked something that wasn't right, or he drunk too much liquor, and we chalk it off as things like that. We don't chalk it off as what it could actually be as a chemical imbalance, or somebody actually might have gave us a drug that might have chemically imbalanced us or altered who we are as a person. We don't even take it to that level because it's nature versus nurture. We were never taught those things.
I think piggybacking off of what Dewan was saying too, I think the first step is being able to say something. Like, a lot of people want to hold it in. It's like, even if it's talking to your primary doctor, like, hey, I'm having these problems, or these are my feelings and my thoughts. When this happened, I feel this way. I think that's a start, and not being afraid to open up, because everybody don't have those resources. And who's going to be a better advocate for you other than you? Like, nobody knows what you're experiencing, those thoughts, those feelings, but you. People can see it here and there, but the reality is you got to live with that.
Then it's not enough of us.
Yep.
The question is, like, what do you guys normally hear? Where does it usually stem from? You know what I mean? Like,
Nature versus nurture.
Yep.
Trauma.
Childhood trauma.
How people were treated. Do you understand what I mean when I say nature versus nurture?
Yeah, the natural things of life and versus to what you may have taken in throughout your what. So explain to me a little bit.
So nature versus nurture is when you're born into this world, what do you know?
What you're taught.
No, when you're born into this world,
Nothing.
Nothing. So when I say nature versus nurture, it's who nurtures you. It's what you taught. Our mental health can go bad as a baby if you're born into the world and nobody ever picks you up. Our mental health can go bad if you're born into the world as a baby and people are sticking their fingers in you, molesting you as a baby.
Right.
If people are dropping you on your head. If people are, oh, this baby ugly, get this baby away from me. If people are not, hey handsome baby,
Right.
how are you, smiling and cooing at you. Those are our first interactions on this earth. And that's what I mean. If our nurturing isn't positive, that doesn't trigger those brain cells in our head to make us be positive and teach us the things that we need to know to be good, positive human beings. So right then and there, our mental health starts to deteriorate and we don't learn and develop the way that we should. So right then and there, our mental health starts to deplete.
Yeah.
Right then and there. So that's what I mean when I say nature versus nurture. If we're not treated how we're supposed to be as when a baby, when we come into this earth, our mental health starts to go bad immediately. Why are you looking like that?
I'm listening, and it's all new to me because I don't understand mental health at all. You know what I'm saying? Like I say, it makes me uncomfortable, especially when I'm dealing with somebody that's close to me.
Okay.
It's like, it's just weird. You know what I'm saying? It's a weird feeling that I get. Like, I be hurt. You know what I'm saying? Like this ain't my people. You know what I'm saying? Like, I be trying to figure it out for them. Like, man, what can be done to eliminate this type of behavior or this? Because I don't necessarily think that they be slow or anything, because they definitely be up to par with their thought process. I mean, I had conversations with my cousin, and it was like, yeah, she need to stop taking this medication, because it seemed like everything was intact. You know what I'm saying? But when the medication kick in, she not there. It's, you know what I'm saying? She gloating. You know what I'm saying? In a whole nother world, and I hated to see her like that. You know what I'm saying? And it just was.
Well, they think all black people have ADHD, so.
Well, when you think about the medication though, and what you're saying, that's a reason for her to have a conversation with the doctor. It's very important that when you're taking medications, when you go to your follow-up appointments, that you talk to your doctors and let them know exactly what's going on. And I will also suggest that if she is experiencing schizophrenia, it would be very important for her also to have a therapist too, just so we can really find out more about her emotions and her behaviors, because usually that schizophrenia comes from something else. That's like a byproduct. It's usually some trauma, something happened
That she didn't deal with or talk to anybody about.
Like,
she buried it, and
she was normal up until.
What is normal though?
Okay, well, she was normal as I would, you know what I'm saying? Because I didn't notice anything different. Even when people were saying, oh, such and such tripping, I used to be like, every time I see her, she good. You know what I'm saying? What y'all talking about?
But that also goes back into like stages of it. Like you may have experienced her when she's not in a manic state, when she's normal, so she seems calm and seems like herself. But then these people that are around her more often sees her in every side of it. Like you have the manic and the non-manic state. So you may have seen her, even though she was offered medicine, she was cool. But something may have triggered her. It could have been something that happened, and it's like now she back into it, and you haven't experienced that. So that's why when other people are like, "Oh, she's tripping," you may look at it like, "Well, that's different for me." So I think it's having that conversation, like, how are you feeling? What are you experiencing when you're feeling these things, to get a better understanding? But again, it goes back to advocating for yourself, having that conversation with your primary doctor, and being able to be open. I always say, like, one of my quotes is like, you want to hide something, put it in the book. Like, in order to help somebody, you first got to be educated yourself. And no, we're not expecting you to be a social worker or a psychologist or a psychiatrist, but having kind of a general knowledge makes a difference. Like, it helps you to be able to navigate with them. You don't have all the answers, but it's like, hey, I read this and this seems like this. Let's talk about it. Like, help this person be able to advocate for themselves, but advocate for the people that's around them, that's dealing with them, because everybody don't look at it the same way.
So can some of the triggers be your surroundings and the people you're around?
Absolutely.
You know what I mean? That make them.
It could be the person that molested you sitting next to you.
You know what I'm saying?
That's a family member.
It's the environment, it's the smells,
a gunshot.
It can be
anything. Glass breaking, someone's voice. That's why we always say indoor, outdoor voice. Because even me, I have triggers. You know our lifestyle. You know what we've been through. People yelling.
Yeah,
that's a trigger for me. I shut down instantly. So I'm gonna tell you something. I have a lot of issues. I have a lot of trauma. But because I've been in so many books, I know how to deal with it. I know what my triggers are. All of us are walking around with mental health issues. Let's be clear. If you're human, we are struggling with stuff. Just because we're the therapist and sitting here, that doesn't mean that we don't struggle with things. And a lot of people don't like going to therapy because the therapists sit and act like nothing is wrong with them. I try to be very open and transparent with my patients. I've been through it all. And so I try not to make my patients feel like I'm holier than thou. And so I do tell them stories so they can relate if it's needed. Now, we don't overshare, but if it's a motivational story, like, hey, I'm doing this so you can do it, or I've been through that, this is a story so you can do it. If it's relatable in that moment, I definitely try to share, because I don't want them to think like, hey, they're sitting next to a person that hasn't been through anything. Because I've been to therapy a lot, and guess what? I've sat across from a lot of therapists who had no idea the trauma I've experienced, and they were unrelatable. And it was hard for me to get that therapeutic experience I needed, and I left empty-handed. So I definitely always try to make sure that my patients understand that, hey, I'm no better than you. I'm from the bottom. I'm from the bottom, and I've been through it all.
I tell people too, like, when you seeking a therapist, use it like a job interview. Like, don't just go sit down with anybody. Like, you need to make sure this person fits you and that person's style fits you. You don't just go down and be like, hey, Miss Lolanda, this is what's going on. Because she may not have experience in it. She may be against whatever this thing is that you're bringing forth. So you have to, one, be comfortable with the person that you're sharing with, because you're being very vulnerable. You're sharing stories and situations that you won't just tell anybody on the street. So being mindful of that too. Like, ask for referrals. Okay, I look at this person's bio, this person specializes in sexual assault. Okay, this might be somebody I want to deal with. Now, if you was assaulted by a male, you might not want to go see a male, because that's going to be a trigger for you. You don't want to sit down with a male knowing that a male did something to you. So let me sit down and talk to somebody that looks like me. Like, I love everybody, but I'm not going to go sit down with an Asian woman. You can't relate to my traumas and what I deal with as a black woman. I'm not saying I'm not giving you a chance, but you need to be relatable to me for me to go. Like, my therapist in particular, black woman. I'm not gonna sit down with you. You an Asian woman. You're like, well, as a black woman, you should. Can't tell me about my traumas because you ain't been there. You ain't did that.
I feel like, yes, that's correct. When you are looking for a therapist, most people are going to want someone who identifies with what they look like. So it's very important for black people to know that there are black therapists out there who look like you and who can help you through issues that you are going through. It is so important to know that you can find a black therapist. They do exist. You should want to seek them. You should want to seek that out. Some ways you can seek that out. I'm sure anywhere and everywhere you can call 211.
But in all fairness, there are some amazing Caucasian therapists.
I agree.
I agree.
And they are relatable, you know, as far as techniques.
Yeah.
You know, as far as
I would agree.
being able to, you know, offer guidance and support. You know, as long as we're not looking for them to be relatable.
Or provide certain kind
A
of
feedback.
Yeah.
Because most times when I talk to some of my clients who have had experiences with Caucasian therapists, the one thing that is always consistent is that I just don't receive the feedback that I was hoping for. And I think that that is a barrier. You know what I mean? It's a barrier because of the cultural awareness and just being relatable in that experience of being African American. We are not only stigmatized when we're looking at mental health or mental illness, but we are also very much dealing with structural racism, very much dealing with colorism issues amongst our own culture. We're also dealing with a lot of other challenges when it comes to employment, education. So if we're thinking about other barriers that African Americans have to overcome just to get help, then we're looking at the bigger picture and understanding why a Caucasian isn't always the first choice when it comes to helping an African American.
But we also have to remember, in our community, it's this big stigmatism where, you know, black people, we can rise through anything and we don't need therapy.
Right.
Yeah.
But because of all the things that have happened to me, I knew that wasn't true.
Oh, no.
My God.
Or having the stigma that something's wrong with you or you're worse off than me because you're black seeking therapy. Like, everybody, not one, like you said, all of us walking this earth got some type of trauma, something we dealing with, and your trauma ain't no worse than my trauma. It's just a matter of how we deal with it in our health. Like,
And that's like when I talk to people and I have certain conversations with different, you know, men and women, and they be like, I don't need no motherfucker. I'll be like, listen, man, we can't do it by ourselves.
Nobody
I mean,
can.
it's some things we can do by ourselves, but it's a process to that. You know what I'm saying? And it can drag itself out as long as you live it. You know what I'm saying? It probably never get done if you think you're gonna conquer the world by yourself. You know what I'm saying? So I try to edge people on to know, like, hey man, I know we all got trust issues, but you gotta trust somebody. Like, if you're trying to like gain progress in life, you're gonna have to trust somebody, you know what I'm saying, to lead you in a better direction, because wherever we going, we don't always know. We're not educated on that path all the time, you know what I'm saying? So you gotta ask questions. You gotta let your guards down to people you may not know. You know what I'm saying? And hopefully they give you the right information that'll lead you to where you're trying to go, and you can help somebody else along your way. But I always try to tell people to change that mindset. I don't need nobody. I can do this. I can do that.
Change the mentality.
So what? I got a question for you. What got you to the point where you're like, your mindset changed about seeking help? Because oftentimes, especially for black men, they're often like shunned and looked like overlooked in a negative light when they're like, hey, I need to seek help. Like, before you got that mentality to say, hey, we got to try something different. Like, what was your experience, or what have you been told as a black man experiencing mental health or possibly experiencing mental health?
Well, me growing up, I ain't never thought I had no issues with nothing. You know what I'm saying? Why you this, why you that? Look where I grew up at. Why you asking me why I'm always mad? You know what I'm saying? I hardly got a lot of stuff to be happy about. You know what I'm saying? That's how I make my happiness. You know what I'm saying? So it be like, as I got older, I knew I had to change. You know what I'm saying? Like, I was doing all kind of stuff. You know what I'm saying? I've been locked up and I did this, I did that, and I came to a point where I'm like, okay, how long I want to live this lifestyle? How long I want to keep, you know what I'm saying, coming into these type of mishaps? You know what I'm saying? Like, I ain't trying to be gone forever, or I don't want nobody to kill me because of the shit that I'm doing. So, I actually changed my thought process at a very young age. I probably was about 14 when I started thinking that, okay, I gotta do something different. You know what I'm saying? Like, I got locked up as a youngin'. They gave me, I could have been locked up for 4 months. I ended up doing 15 months because of my mindset. You know what I'm saying? So, after doing it, I'm like, damn, I turned 4 months into 15 months? I gotta be crazy. You know what I'm saying? Like, so I started thinking like, man, listen, I'm doing more reading. You know what I'm saying? I'm paying attention to life more. You know what I'm saying? Before, I'm in the streets, and that's all I was really paying attention to, is the streets. So once I began reading and letting my mind elevate, you know what I'm saying, and listening to myself, I started thinking outside of the box, outside of the neighborhood. You know what I'm saying? Like, okay, growing up, I didn't have nobody really egging me on to do something different. You know what I'm saying? Or even giving me no education on the things that I was doing. So I'm like, how can I prevent this cycle? You know what I'm saying? Then I had a son. I'm like, whoa, this ain't finna happen for him. You know what I'm saying? So as he was growing up, I always told him, listen, don't. I know you see some of the stuff that I do, but don't you dare make these decisions. You know what I'm saying? I make all the mistakes so you don't have to. You know what I'm saying? So I kind of carried that with me. So when I did have people around me that was able to listen or willing to listen to the things that I had to say, I always gave them a positive direction if I could. You know what I'm saying? Or if they was doing something wrong, I tried to help their situation by telling them a better way. You know what I'm saying? Like, we can't always change a person's direction of life, but if you got some information to help that person, then why not?
Put a word of wisdom in that ear.
You know what I'm saying? What is it gonna hurt for me to tell a person some positivity?
Nothing.
It ain't gonna hurt nothing. Cause I wish I had that in my life.
Don't.
So that's why I'm here and doing the things that I do differently. You know what I'm saying?
Kudos to you.
I'm not in the streets like that. You know what I'm saying? I still know and cause who I am, but as far as like being active and doing certain things, no, I'm good. I'm straight. You know what I'm saying? Like, if that's what y'all choose to do, go ahead. But listen, here goes some information for you if you want to take heed to it. You know what I'm saying? And then, like, as far as mental health, like I say, I got family members that I don't understand no more. You know what I'm saying? I have an
We all
auntie
do.
that just recently, probably like maybe 3 years ago, her behavior changed or her mental changed. I don't understand that. It hurts me like a mug to see my auntie go through that. You know what I'm saying? So